Ships can be hazardous places, and they're seldom close to professional medical facilities. So whether through illness or injury, there is always the chance that the life of a fellow seafarer or a passenger could be at risk. Your ability to deliver effective first aid could mean the difference between life and death. The 2 videos in this training package are modular, and we suggest that you look at one section at a time and then consult the supporting booklet, which expands on the points made in the video. Effective use of this training material will help you to deliver basic first aid to casualties on board. In any emergency, one of the most basic requirements is continuing the supply of oxygen to the brain. All humans need oxygen. They take it from the air they breathe. The air passes down the windpipe into the lungs, and from there, the oxygen is taken into our blood. The arteries then carry oxygen to where it's needed all around the body, especially the brain, because its needs are the most vital. If the brain is starved of oxygen for 3 minutes, the brain cells start to die, leading to brain damage or death. Yet, you don't have to be a doctor to be able to help. 3 letters, A, B, and C, sum up nearly all the basic problems. A is for airway. Is it open and clear? Can air get into the body and to the lungs? B is for breathing. Is the victim breathing so that oxygen can enter the bloodstream? And C for circulation. Can the heart pump the blood with its oxygen so that it reaches the brain? Is there enough oxygen in the blood? And is there enough blood to do the job? Here, a crew member has apparently drowned. First, remember to check for any possible dangers to yourself and the casualty. Check the casualty and see if they respond. Gently shake their shoulders and ask a question in a loud voice to try and get them to respond. If they don't respond, shout for help if you're on your own, or send someone for help and start ABC. Look to see if the mouth is clear. Then open the airway by lifting the chin and tilting the head back. Look, listen, and feel for breathing. Take 10 seconds to do this. If the casualty is not breathing, or only taking occasional gasps, give 2 rescue breaths. Open their mouth a little, maintaining chin lift. Take a deep breath, filling your lungs with oxygen, and place your lips around the casualty's mouth, making sure that you have a good seal. Pinch their nose. Then blow steadily into their mouth while watching their chest. Take about 2 seconds to make their chest rise as in normal breathing. Maintaining head tilt and chin lift, take your mouth away from the victim and watch for their chest to fall as air comes out. Take another breath and repeat the sequence to give 2 effective rescue breaths in all. If you have any difficulty achieving an effective breath, then recheck the casualty's mouth and remove any obstruction. Check that there is adequate head tilt and chin lift. Make up to 5 attempts in all to achieve 2 effective breaths. Even if unsuccessful, move on to the assessment of the circulation. If you have been trained to do so, check for pulse at the neck for up to 10 seconds. During this time, look for other signs of circulation, such as movement or an improvement in the casualty's color. If there are no signs of circulation, you need to give the casualty chest compressions to stimulate oxygen to the brain. Place the heel of one hand on the middle of the lower half of the breastbone. Place the heel of the other hand on top of the first. Interlock the fingers of both hands and lift them to ensure that pressure is not applied over the victim's ribs. Avoid any pressure over the upper abdomen or bottom tip of the breastbone. Position yourself vertically above the victim's chest, and with your arms straight, press down on the breastbone to depress it about 4 to 5 centimeters. Release all the pressure without losing contact between the hand and breastbone. Repeat this action at a rate of about 100 times a minute. That's just under 2 compressions a second. It may help if you count aloud. Compression and release should take an equal amount of time. Combine these chest compressions with rescue breathing. After 15 compressions, tilt the head, lift the chin, and give 2 effective breaths. Return your hands without delay to the correct position on the breastbone and give 15 further compressions, continuing compressions and breaths in a ratio of 15 to 2. If you are on your own, remember to go for help after 1 minute. If you have sent for help, only stop CPR if the casualty shows signs of circulation, if the victim makes a movement, coughs, or takes a spontaneous breath. Otherwise, resuscitation should not be interrupted. You should continue resuscitation until either qualified help arrives and takes over, the victim shows signs of life, or you become exhausted. In an unconscious patient, you may need to insert a girdle airway or similar device to help maintain a clear airway. Size the airway correctly by measuring from the middle of the mouth to the angle of the jawbone. Then gently slide it into the mouth with the outer curve towards the tongue. Then rotate it through 180 degrees. Push the airway in until the flange is resting on the teeth and gums. On land, a first aider would avoid moving a casualty until the ambulance arrives. But at sea, you will need to get the casualty below, to sickbay or cabin. Moving accident victims is a specialized skill in its own right, and is covered in Part 2.
1, 2, 3.
Oxygen to the brain is also threatened when someone has a heart attack. The usual symptoms are a persistent, crushing pain in the chest, accompanied by faintness, ashen skin, and blue lips.
In my chest and on my left arm.
Your immediate priorities are to reassure the patient and reduce further strain on the heart by keeping them still and sitting up in a comfortable position.
What seems to be the problem?
It's in my chest and on my left arm. I can't breathe.
Okay, let me just check so we can get a pulse.
Then, after carrying out your assessment, you have to get the casualty below. If there are no signs of life, follow the basic life support action plan and start resuscitation.
On count 3. 1, 2, 3. Lift.
If there is an automated external defibrillator available and you've been trained to use it, then do so. First, switch on the defibrillator and attach the electrode pads to the chest. Ensure that nobody touches the casualty whilst the defibrillator is analyzing the rhythm.
Analyzing Analyzing heart rhythm. Do not touch the patient.
Follow the electronic spoken and visual directions.
Shock advised.
If a shock is indicated on the defibrillator, ensure that everyone is well away from the casualty. Then push the shock button as directed.
Press the orange button now. Shock delivered.
Repeat the analysis or shock as directed by the machine. Do not try to check for a pulse between the first 3 shocks.
It is safe to touch the patient.
After 3 shocks, check for signs of life. If there are no signs of life present, perform CPR for 1 minute. The automated external defibrillator will time this. Then, analyze once again.
Analyzing heart rhythm. Do not touch the patient.
Most automated defibrillators carry out this analysis automatically. If no shock is indicated and there are no signs of circulation, carry out 1 minute of CPR and then repeat the analysis. If, after 3 shocks, there are no signs of life, check for breathing. If the casualty is breathing, put them into the recovery position. If the casualty isn't breathing, then start rescue breathing, checking for circulation every minute. One of the most dangerous threats to the brain's oxygen supply is the inhalation of gas or smoke, simply because the gas replaces air and therefore oxygen in the victim's lungs. The great danger with many gases is that you can't smell them and therefore don't know that you're inhaling them. So, your first priority in a situation like this is to avoid becoming the next victim. Always ensure that you have the right breathing equipment before entering any enclosed space where there might be gas or smoke.
Okay, put him up.
With the casualty in a safe environment, your first task is to monitor ABC and make sure the oxygen supply is fully restored. In this case, the casualty is not breathing. You have to begin resuscitation as quickly as possible. But you must not use mouth-to-mouth ventilation if you suspect or know that a casualty has been exposed to cyanide gas. If the ship has just been fumigated, there will be a strong chance that cyanide is the culprit. If you do perform mouth-to-mouth, you may become the next casualty. Use a pocket mask instead. If available, give them oxygen. This will speed recovery and is the best treatment.
Here we go. Just put the mask on there.
Another common effect caused by gas is convulsions. This is when the muscles contract in an uncontrolled way because the brain is severely irritated. The casualty is usually unconscious. Again, you place them in the recovery position, but only when the convulsions have stopped. Make sure there are no hard objects on which they could hurt themselves, especially their head. Remember that their breathing and heart could stop at any time, so you must monitor continuously and be ready to resuscitate. Another threat to oxygen supply is choking. The first signs are difficulty in breathing and speaking. The casualty may also point to their throat. If they're unconscious, their skin may be blue, particularly the lips, but usually the casualty will be able to show you what is the matter. Encourage them to cough. If that doesn't help, the most straightforward method is to bend them slightly forward and give them up to 5 sharp slaps between the shoulder blades. The next step is an abdominal thrust. Hold the casualty from behind, link your hands between the navel and the breastbone, and pull in and upwards sharply. Attempt up to 5 goes. If it doesn't work, be persistent. Alternate slaps between the shoulder blades with abdominal thrusts. Back slaps or abdominal thrusts, whilst they're conscious, will succeed in moving the obstruction.
You all right? Oh, God, thanks. I thought I was dying.
All injured people will suffer from shock. If unrecognized or untreated, it can cause death. Shock is a widely misunderstood condition in which the vital organs are deprived of blood and oxygen. It results from bleeding, burns, and fluid loss. Unless treated quickly, it can lead to permanent disability and death. As we saw earlier, the key to ensuring the oxygen supply is ABC: airway, breathing, and circulation. But it's not only the brain that needs oxygen. The rest of the body needs it too. And if oxygen is in short supply, the condition known as shock will develop. Shock has nothing to do with getting a fright. The shortage of oxygen in the tissues may occur because the heart isn't pumping strongly enough, or because less blood is circulating. This can happen through bleeding or loss of other body fluids due to burns, severe diarrhea, or vomiting. If shock continues, the shortage of oxygen can cause failure of vital organs, such as the liver and kidneys. In all cases, the body's response is to withdraw all the blood supply from the surface to the core of the body, causing the casualty to become pale. You will need to combat shock in the first few minutes of an emergency. But at sea, you are likely to have to care for the casualty for much longer than on land. Shock has to be treated along with any other injuries, and the first step is being able to recognize the symptoms. One of the difficulties is that your attention would normally be focused on other, more visible problems. So this is a relatively simple example. The victim has been hit hard on the stomach by a heavy falling object. There is no external bleeding to distract you, but symptoms of shock might well develop because of internal bleeding. Because shock starts with a flow of adrenaline, one sign is a rapid pulse. For an adult, anything over 100 beats a minute. If there is no pulse detectable at the wrist, check the neck. Look for pale, grey skin, especially inside the lips. If you press a fingernail or earlobe, it will be slow to regain its colour. Look for sweating or cold, clammy skin. Where a preliminary examination has led you to suspect internal bleeding, all you can give to begin with is the basic treatment for the onset of shock. First, lay the casualty down to help the blood flow to their brain. Quickly check their legs for injury.
Okay, all right. I'm going to try and put your legs up now.
And if there is none, raise and support their legs so that blood is returned more easily to the heart.
Okay, all right, just lifting.
The victim's legs are less important for now.
Pressure off your stomach and you should feel better.
Loosen any tight clothing around the neck and waist that might constrain their breathing. And be sure to keep the victim warm. In this case, the victim is conscious and breathing, but you must be prepared to resuscitate at any time if their condition deteriorates. Call for help at the earliest opportunity.
I'm just going to take your pulse.
Internal bleeding can be easily overlooked with fatal results. This casualty is showing all the main symptoms of shock: rapid pulse, pale skin, sweating. With no signs of external bleeding or burns, you have to ask yourself why the victim is in this state. Internal bleeding is a likely cause. What can happen is that the accident takes place several hours before shock sets in. This man was hit in the stomach, but at the time thought nothing of it. Later, he felt very ill and weak. The internal bleeding caused by the injury had reached a critical point. That is why he is now in a serious condition. But in most situations where shock is setting in, you have to deal with an equally pressing problem. In this case, severe bleeding. Remember, whenever you are dealing with blood accidents, always protect yourself first. Next, check the wound for any foreign bodies. Then try to stop the bleeding by pressing on it with a clean cloth, or failing that, with the victim's hand. Try not to let the victim out of your sight while you call for help. Your priority now is to get him below into a more controlled environment. If there are any spurts of blood, it means that an artery has been cut. If the artery is a small one, the bleeding may be stopped, as here, by applying direct pressure to the injury. If direct pressure doesn't stop the bleeding because a bigger artery has been cut, you can try to stop the spurting by pressing on the artery further up the limb. If this doesn't work within a few seconds, apply a tourniquet. A tourniquet should only be used where there is uncontrollable bleeding from a limb or after traumatic amputation.
Just bear with me for a minute.
Always radio for medical advice after applying a tourniquet.
I've done this, I'll make it a lot better for you.
To gain access to the wound, cut away or remove the victim's clothes, being careful not to make the pain worse. When someone has been scalded, your priorities are to prevent further injury, cool the affected part, and relieve the pain. Make sure there is no further danger to the victim or yourself, and then douse the victim with cold water as quickly as possible. You should do this for at least 10 minutes. It is the single most important way in which you can help the casualty at this point. Whilst you're cooling the burn, remove constricting items such as rings or watches. Before obtaining radio-medical help, you must assess the injury.
I'm just going to take a look at your legs. Okay, I'm just going to get a blanket so we can raise your legs so it makes you feel a bit better. I'm just going to lift your legs up.
Burns and scalds are classified as superficial, partial thickness, and full thickness. Superficial burns affect only the outer skin layer, causing redness, mild swelling, tenderness, and pain. Partial thickness burns extend deeper into the skin. The affected area is a darker red, the swelling is worse, and there is blistering and weeping of fluid. Full thickness burns are where the skin may be charred, black, or brown. Leathery or even white, depending on the cause of the burn. They involve the whole thickness of the skin and may extend to the underlying tissue and bone. There may be no pain because the nerve endings have been destroyed. You also need a quick way of calculating the extent of burns across the surface of the body. One of the recognized methods is the rule of nines. The surface of the body is divided into 12 separate areas. 11 of 9% plus 1% for the genitals. These are the head, the front of the chest, the abdomen, the upper back, the lower back, each arm, the front of each leg, the back of each leg, and the genitals. Here, with partial thickness burns to the front and sides of the upper legs, the figure would be around 15%. With burns over 15%, or with any full thickness burns, or with burns to the face, neck or genitals, or if you're in any doubt, you must seek radiomedical advice. At sea, you may have to look after your casualty for hours or even days before they can be taken to hospital. But you are not completely alone. You have two strong allies. The first is the ship's medical chest. The IMO recommends a list of items that should be carried on board. You must know what and where they are. The IMO guide gives a concise explanation of drugs and their function. You will find it extremely helpful in mastering the medical chest. Your other big ally is radiomedical advice. The shore-based doctor provides expert guidance for any medical situation you might face and helps decide if the casualty should be evacuated. The benefits from this system depend on the accuracy of the information you provide to the doctor and on the advice they give you. It's a good idea to tape the conversation so that you can listen to the advice again later. All the techniques are based on the IMO guide. But whatever book your ship uses, it should give an explanation of how to examine and what to look for. The key points are these. Is the casualty breathing? Is the chest moving up and down? Are they breathing easily or with difficulty? Does it hurt them to breathe? Heartbeat. What is the pulse rate? Is the beat strong or weak? If trained, the easiest place to check is at the neck, but you can also check the wrist area. What is his temperature? You also need to assess the level of consciousness. Start with the eyes. Do they open spontaneously? Do they open on command? Can the casualty move them? Do they only open in response to pain, or do they remain closed? If you shine the light into their eyes, do the pupils contract? And are the pupils equal in size? Having established the vital signs, what is the casualty's general appearance and manner? The ears. Is there blood in the ear canal, especially if a blow to the head is suspected? Are they relaxed or tense? Do they respond normally, or is the response impaired? Is the casualty in pain? If so, where? The skin. Is it unusually warm? Is it moist or dry? Are the insides of the lips blue? Are there rashes or sores? What do they look like? Arms and legs. Can the casualty move them? How strong are they? Are they straight or distorted? Is there any swelling?
Okay, can you wiggle your toes for me? Okay. Feel that?
The nervous system. Is the patient rational? Can they tell you the date and do simple arithmetic?
And back across again. How many now?
2.
Okay, can you tell me what day it is?
Monday.
Okay, that's great.
What is the appearance of urine and stools? Is there any blood? As well as observing accurately, you need to observe often. The doctor on shore will want to know how the casualty's condition is changing, because this will give them the best means of predicting what will happen next. The next thing to consider is speech. Does the casualty respond sensibly to questions? Do they seem confused? Are they making incomprehensible noises? Or do they say nothing at all? The third part of the scale concerns movement. Can the casualty obey simple commands? Will they move in response to pain if you pinch their Achilles tendon? One answer from each of these 3 categories, eyes, speech, and movement, will give the doctor an instant snapshot of the casualty's state of consciousness. When time is precious, it's a valuable shortcut. When you have mastered the medicine chest and learned the skills of observation, you will be able to apply this knowledge to many types of casualty. Give the patient an aspirin and tell him to chew it slowly. This may help reduce damage to the heart. And seek medical advice as quickly as possible. While you're making the casualty as comfortable as possible, continue to monitor their breathing and the pulse, if trained to do so, every 10 minutes. Be prepared to resuscitate. Do not give your casualty alcohol or a cigarette. If the patient is conscious, make them comfortable. A half-sitting position with their head and shoulders well supported and their knees bent is often best. Give them oxygen continuously until they recover. If the patient is unconscious, put him in the recovery position. In all these situations, remember that your main aim is to maintain the supply of oxygen to the brain. The condition of this casualty means the doctor will almost certainly want to get them off the ship as quickly as possible. Assuming you are close enough to land, this will be done by helicopter, but you may still have to wait for several hours. As a rule, evacuation is a last resort and only done on medical advice. It's why care of your casualties on board ship is such a serious responsibility. Make sure their medical records and your observation notes are with the casualty, as well as their passport. You should also attach a tag showing how much morphine or other medication they have had, and when they last had it. You will need to ensure that the casualty is strapped in securely and cannot possibly fall out of the stretcher. They must also be kept warm. Getting cold will accelerate the progress of shock. Suction must be available in case the casualty vomits. In most cases, the helicopter will probably use its own lightweight stretcher. Somebody must go with the casualty in the helicopter and at all times follow the instructions of the medical crew exactly. In caring for casualties on board ship, the keys to success are persistence and attention to detail. These are your best ways of improving their chances of survival and recovery. In Part 2, we show how to deal with fractures, medical conditions such as asthma and diabetes, and also consider the movement of injured personnel. Further details are also available in the booklet that forms part of this package.